Obviously, when something's new, you're always going to have a little bit of skepticism, a little bit of fear, something that nobody else has had before. But I also felt like it was the only way for us to start, getting past COVID-19, or at least attacking COVID-19 and really making some progress. If you do your research and see how the vaccine works and how long the technology's been in the works, even though the actual vaccine is new, that is something that, especially as a healthcare provider, we really need to set the example and show patients that the vaccine is safe, and it's something that we can all, get to help everyone, to help the entire, yourself and the community.
The dosing of the vaccine is, I would say, very similar to what it feels like when you get a flu shot, a little bit of achiness in the arm. And the only difference is that you have to wait about 15 minutes in the location where you get vaccinated to make sure you don't have any side effects. After that, I left and I went home, and that day pretty much just felt a little bit of soreness in your arm, like if someone poked you, but otherwise I didn't feel any side effects.
The next morning, I would say about 24 hours after I got the shot, I could feel like a little bit tired. That was it though, but I was able to go to work, no big deal. It was actually Christmas Eve, so I had a lot of things to do and I was able to get it all done, and it was not a big deal at all.
The only thing I experienced with the first injection was some soreness in the axillary area for a few hours, and that was it. This was really easy. I feel good about it. I feel empowered. I feel like I have a shield.
I did have some soreness in my arm. Typical to what you'd experience after the flu vaccine. This was a little bit more severe, honestly, but it was tolerable. This lasted for about 2 days. Thereafter, actually about 24 hours later, I did feel just, slight symptoms of fatigue, but not anything to go to town about. These slight symptoms lasted for another 24 hours, and then I felt back to normal. This was my experience with the first vaccine.
21 days later, I received the second dose of the Pfizer vaccine. That one was a little bit more uncomfortable. That one I had some arm pain, some tingling of the arm over the day. The most uncomfortable part was shivering. I shivered throughout the day a few times, but nothing else, no fever. I used the day to rest. It was a good excuse to watch TV and catch up on things that I had not done in a while, like read. But I really did not feel anything. I was very, very happy, very blessed. I'm so grateful that I was able to get both of them.
The second vaccine, I actually had less arm soreness, which I was surprised about. I guess everyone had kind of prepared me for the worst with the second vaccine. And then no other side effects, really. Maybe 2 days later, I had some different type of arm soreness, like my full arm was a little bit sore, but no more localized tenderness or anything like that. And then no other systemic side effects.
I actually had no symptoms with the second vaccine. I did better with the second vaccine than I did with the first, and I'm very relieved that I'm vaccinated. Interestingly, I tested myself 2 weeks after the first vaccine, and I already had antibodies. And the rest of my staff, I also subsequently tested after their first vaccine, and they all had antibodies also. So it's apparent that the first injection does give immunity towards COVID.
The second COVID vaccine was a little different. I had no discomfort at the site on the date that I received it. I would say that about 12 hours after being vaccinated, I started feeling some joint pains, some body aches. I had a low-grade fever, 100.3. The headache was about 2 or 3 days in duration, but the other symptoms resolved within about 36 hours. And I think that's what most people are experiencing with a second dose, and that's something we would expect, because our body is mounting an immune response. So I actually felt comfortable with the idea that my immune system was responding, mounting antibodies, and hopefully protecting me moving forward.
Both of the approved vaccines so far have a humongous amount of data that was well done. It was a blinded study, and it has proven efficacy. And the difference between them is negligible. They're probably equally as effective. Everybody should get vaccinated. It doesn't matter which one you get, as long as you get it.